Greetings students. In this session, we are going to see about morphology of alcoholic liver disease, its consequences and complications. The alcoholic liver disease, it initiates with the steatosis. It is a condition characterized by abnormal accumulation of triglycerides within the parenchymal cells. The hepatic steatosis is reversible even when extensive. So this is how the normal liver appears. And this one is the fatty liver, where you can appreciate the yellowish tinge of the hepatic surface. It is greasy to touch and it has rounded borders and it is enlarged. It would weigh around 4 to 6 kilograms. On progression, ultimately it will result in cirrhosis of liver. The image which is shown over the right side. So this is the histology image of a normal liver, and on the right side you can see the hepatocytes with the lipid vacuoles, which is seen as empty spaces. The lipid is dissolved during the tissue processing, so it appears as an empty cells. To demonstrate the fat, we should apply special stains like Sudan black, oil red on fresh tissue to demonstrate the fat. Otherwise, it would be seen only as empty vacuoles. In a routine tissue processing method, the fat lipid is lost during the processing. So you can see the histology image where the hepatocytes are completely occupied with the lipid droplets. It is filled with lipid droplets. Thereby, it pushes the nucleus to periphery and it is seen as empty vacuoles. Sometimes the vesicles, which will be smaller to begin, but later it will be completely occupying the cell, which is called as macrovesicular steatosis, and sometimes this can rupture to form fatty cyst and it can form lipid granulomas, and it can progress to fibrosis, which can be demonstrated with Mason's trichrome. And this fibrosis is characteristically perivenular, that is, it starts around the central vein around the zone 3. Alcoholic hepatitis, this develops acutely, usually following a bout of heavy drinking. It occurs in 10 to 35% of heavy drinkers. This alcoholic hepatitis is superimposed on pre-existing hepatic steatosis, and it increases the risk of development of cirrhosis of liver. Grossly, the liver would appear mottled red with bile-stained areas of normal or increased size, and it contains some visible nodules and fibrosis. This is the histology image of alcoholic liver disease, where you can see in the steatohepatitis, we can see the clusters of neutrophils around a necrotic hepatocyte, and there would be Mallory bodies, which will be seen as a pinkish material within the cytoplasm, and there would be some amount of fibrosis. So you would be able to appreciate the ballooning degeneration of the cells, inflammatory infiltrates of neutrophils and lymphocytes, in the background of macro and micro vesicles of fat globules within the cytoplasm of the hepatocytes. Mallory Denk bodies are nothing but the cytokeratin accumulation as cytoplasmic perinuclear eosinophilic inclusions. And finally, it would result in cirrhosis. Cirrhosis is the irreversible form of alcoholic liver disease. It evolves slowly and insidiously. The cirrhosis is a diffuse process characterized by fibrosis and conversion of the liver architecture into nodules. Here we could appreciate the the regenerating nodules of liver surrounded by a dense fibrosis, which is highlighted with the Mason's trichrome as bluish discoloration. And the gross appearance of a cirrhotic liver, in early stage it would be micronodular, yellow fatty, and the mild enlargement of liver would be seen. Whereas in later stages it would be macronodules more than 3 millimeters, it will be brown, and it will be shrunken liver. So moving further to liver failure topic, it may follow acute injury or chronic injury, but may also occur as an acute insult superimposed uh, on an otherwise well compensated chronic liver disease. So in alcoholic liver disease, it proceeds from a normal liver to fatty liver, steatohepatosis, cirrhosis, a completely decompensated liver. Etiology of acute and chronic liver failure includes drug-induced conditions, viral infections, metabolic causes, autoimmune disease, vascular lesions, and pregnancy-related conditions. So we could few of it would be remembered in the form of mnemonic, starting from A to F. A stands for acetaminophen, hepatitis A, autoimmune hepatitis. B stands for hepatitis B infection, Bucciari syndrome. C, hepatitis C infection, cryptogenic conditions. D stands for drugs, toxins, hepatitis D infection. E stands for hepatitis E and other esoteric causes like Wilson's disease, Bucciari syndrome, lymphoma, carcinoma. F stands for fatty change of microvesicular type, fatty liver of pregnancy, valproate, tetracycline, and Ray's syndrome. The fatal sequelae of liver failure includes coagulopathy, encephalopathy, portal hypertension resulting in bleeding, varices, hepatorenal syndrome, portopulmonary hypertension. As the disease progresses, it would result in cirrhosis of liver. It is characterized by irreversible end-stage disease with the disorganized architecture of entire liver parenchyma. The nodule formation is separated by fibrotic bands, which will be alternating with necrosis and regenerative nodules. The cirrhosis can be classified based on the morphology or etiology. The morphological classification is based on the size of the nodules. If it is less than 3 millimeter, it is called micronodular cirrhosis. If it is more than 3 millimeter, it is called macronodular cirrhosis. And if it is a mixture of both, it is called mixed cirrhosis. Etiological classification based on the cause of it. Most common would be the alcoholic cirrhosis. Others include post-necrotic cirrhosis due to the viral infection, biliary cirrhosis, pigment cirrhosis and hemochromatosis, cirrhosis in Wilson's disease, alpha-1 antitrypsin deficiency, cardiac cirrhosis, Indian childhood cirrhosis, cirrhosis noted in autoimmune hepatitis, cirrhosis in non-alcoholic steatohepatitis, and in miscellaneous forms of cirrhosis like metabolic, infectious, GI neoplasm, and cryptogenic cirrhosis. In this slide, there is a schematic representation and the gross image of the liver where it shows the micronodular and macronodular cirrhosis. The liver would be enlarged with yellow rounded margins, and the irregular nodular surface would be prominent enough to resemble a hobnail. The micronodular cirrhosis, the nodules will be less than 3 millimeter and it will be uniform nodularity distributed in the entire liver. In macronodular cirrhosis, the nodules will be more than 3 millimeters. It will be irregularly distributed on the surface. So the nodule formation occurs with the dense fibrotic bands, deposition of the collagen, separating the regenerating nodules of hepatocyte, and this would give a appearance of chicken wire appearance. And the alcoholic liver disease, the fibrosis starts at the zone 3 region in the perivenular region. Ultimately, cirrhosis of liver would result in increased hepatic resistance, which increases the pressure in the portal vein, leading to portal hypertension. So portal hypertension will be associated with the variceal formation, which increases the risk of variceal bleeding. There will be increase in release of nitric oxide. So there will be systemic vasodilatation that activates the renin-angiotensin-aldosterone system to cause ascites. There would be antidiuretic hormone release in excess, resulting in hyponatremia. There will be sympathetic nervous system activation resulting in hepatorenal syndrome. And there will be an increase in the gut-derived peptides, translocation of the gut bacteria, and in addition there will be increase in the pressure in the portal vein due to increase in flow, results in increase in nitric oxide release, resulting in splanchnic vasodilatation. Again, in turn, it will cause the increase in portal inflow. So these are all the consequences and complications of alcoholic liver disease. Thank you.